Mari kita mulakan kita punya perbincangan tentang GIT dulu, iaitu tugas yang telah diberikan oleh Dr. Ong kepada kita. Dan kita dapat tajuk Colorectal Cancer. Okay, mula aku nak tanya, apa itu colorectal cancer?
Colorectal cancer itu kanser lambung besar.
Dapat saya apa itu colorectal cancer? Apa yang faham tentang colorectal cancer?
Kanser usus besar.
Okay, kanser besar. Okay. So kita tahu dia adalah satu disease atau pencakitan daripada sel abnormal pada usus besar kita. So mendatangkan kanser. Okay, sekarang kita tahu dah betul colorectal cancer. Sekarang kita kena cari dia punya nursing care plan dan juga nursing management. Okay, untuk tugas satu kita akan bincang pada lain tu. Sekarang kita boleh cari seluruh poin masing-masing. Kita cari poin, lepas tu kita kumpulkan dan kita bincangkan lagi.
Akan dengan dalam meeting yang akan datang.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Okay, hari ni kita terpaksa buat Google Meet. Sekejap je ni kita bincang untuk kita menambahkan lagi kita punya poin. Okay, sebabkan kita ada masalah sikit, so kita terpaksa buat meeting lah. Hari ni aku nak bincang pasal ni je, pasal nursing management. Saya mana dah poin tak?
Untuk pelayan sini.
Okay, nursing management ni kita cerita dulu poin-poin kita. Lepas tu lagi kita letak dalam kita punya slide. Okay, untuk aku, untuk poin pertama aku sebabkan kita ada 4 orang, aku suruh kita cari satu poin seorang. Okay, untuk poin aku guna poin surgery. Okay, bila ada colorectal cancer ni, kita kena lakukan surgery terhadap patient tu. Surgery untuk buang tumor tu. Okay, dan surgery ni dia ada tiga tahap. Yang pertama laparoscopic surgery. Yang kedua colostomy for rectal cancer. Yang ketiga radio frequency ablation atau RFA atau cryoablation. Okay, poin pertama aku, laparoscopic surgery ni some patient may be able to have laparoscopic colorectal cancer surgery. Dengan teknik ni, several viewing scopes are passed into the abdomen while a patient is under anesthesia. Maknanya doktor tu akan masukkan skop ke dalam abdomen patient untuk tengok di mana tu kanser tu dan lakukan pembedahan. Okey, itu je untuk poin aku. Second Syahidah.
Poin aku, radiation therapy. Radiation therapy ni guna high energy X-ray to destroy cancer cell.
Okay, faham.
Kebiasaannya
radiation
terapi ni digunakan sebelum surgery untuk mengelakkan colostomy ataupun reduce the chance that the cancer will recur. The main benefit include a lower rate of the cancer coming back in the area where it started. Tu je poin aku.
Okay, faham. Tak apa, kita santai-santai je, kita layan-layan je. So hari ni kita meeting lagi. Hari ni kita nak bincang macam hari tu kita dah cadang untuk bincang pasal nursing care plan untuk colorectal cancer. So this is the day. Okay, untuk aku dah sediakan satu nursing care plan. Aku jumpa dekat internet. Okay, bunyi dia macam ni, deficient knowledge related to new diagnosis of colon cancer as evidenced by patient's vocalization of I want to know more about my new diagnosis and care. Maksudnya patient tu sendiri nak tahu apa itu colon cancer, apa ia dapat cancer ni dan cara untuk rawatnya sendiri. Okay, nursing intervention explain what colon cancer is and its symptoms, avoid using medical jargons and explain in layman's terms. So rationale dia untuk provide information on colon cancer and its pathophysiology in the simple way possible. Okay, tu satu poin aku lah. Yang lain tu poin yang slide lah. Okay, idea saya mu?
Kalau aku, diarrhea. Goalnya untuk utilize medication to control diarrhea and symptoms are described. Nursing intervention yang aku jumpa, access abdomen. Lepas tu yang kedua, monitor intake and output. Yang ketiga, administer medication as needed. Questionnaire aku akan bagi tahu dalam present final.
Okay. Tu aku akan tunggu untuk tu. Okay, next.
Yang pula risk of infection related to chemotherapy. Goal dia, the patient will remain free from infection. Dia punya intervention club adalah
Tahu tak?
encourage and practice good hand washing before and after patient's care. Isolate the patient during ongoing chemotherapy or radiotherapy and many more.
Okay. Okay, next point. No?
Ya, aku death anxiety sebab death and anxiety patient semua ada sebab dia orang takut apa yang akan jadi lepas chemoterapi dan takut akan rawatan seterusnya. So goal kita ni just untuk hilangkan rasa death and anxiety kepada patient kita. So nursing intervention yang aku jumpa adalah consider psychosocial maturity of the patient. Lepas tu kita ni perlu tenangkan patient kita. Kita macam kena cakap dengan dia apa-apa je untuk tenangkan dia, macam tak ada efek langsung kepada apa nama body dia disebabkan kemoterapi.
Ni kamu bagi rasa takut tau.
Kamu bagi dia rasa takut disebabkan kemoterapi.
Jadi ni faham aku. Memang dia tahu lah kemo tu banyak side effect yang, tapi kita kena tenangkan dia tau.
Kita kena redahkan dia kepada itu supaya dia takut kepada kemoterapi.
Okay, bagus. Okay, next. So, saya mudah well prepared. Okay, kita tunggu masuk pada slide and final meeting and kita punya tu lah. Okay, that's all untuk hari ni. Okay, thank you.
Untuk nursing management, bagi saya, giving information. The nurse, they should inform the patient and the family of the characteristic and common to fraudulent therapies. Because with the info, the caution whenever the patient will be cautious when evaluating other form of therapies. Maknanya patient tu akan lebih well prepared and mengetahui lebih tentang terapi yang dia akan hadapi. The nurse should inform the patient and the family of the characteristic and common to fraudulent therapies. Because with the inform, the caution whenever the patient will be cautious when evaluating other form of therapies. Maknanya patient tu akan lebih well prepared and mengetahui lebih tentang terapi yang dia akan hadapi.
Nursing management surgery. During this procedure, the surgeon removes the part of your colon that contains the cancer along with a margin of normal tissue on either side of the cancer. Your surgeon is often able to recognize the healthy portions of your colon or rectum. This procedure can commonly be done by minimally invasive approach, laparoscopy.
Jadi ini adalah nursing management saya, iaitu radiation therapy. Radiation therapy ni use of high energy X-ray to destroy cancer cell. Chemo radiation therapy is often used in rectal cancer before surgery.
Chemotherapy. Chemotherapy uses drug to destroy cancer cells. Chemotherapy for colon cancer is usually given after surgery if the cancer is larger or has spread to the lymph nodes. In this way, chemotherapy may kill any cancer cell that remain in the body and help reduce the risk of cancer recurrence.
Move to the nursing care plan. The first nursing diagnosis is deficient and knowledge related to new diagnosis of colon cancer as evidenced by patient knowledgeable. The goal is patient will be able to demonstrate the knowledge of colon cancer and the management of the colon cancer. For first nursing intervention, the nurse should explain what colon cancer is, what is colon cancer is, and the symptoms. Provide using the medical terms. The rationale is to provide to to provide the information of colon cancer and its pathophysiology in the simplest way to patient understand it. The second, educate the patient about the colon cancer treatment plan, explain the treatment protocol, the risk, the purpose, and the possible side effects. The rationale is to give the patient enough information on the treatment plan so they can provide on or deny an informed consent. Thirdly, ask the patient to repeat or demonstrate the self-administration details. Rationale is to inform the patient of each prescribed drug and to ensure that the patient fully understands the purpose. The last one is use open-ended questions to explore the patient's lifestyle choices and behaviors that can be linked to the development of colon cancer. Rationale is to assist the patient in identifying and managing the risk factors related to the colon cancer. So,
Jadi ni adalah nursing care plan saya, iaitu diarrhea. Nursing diagnosis dia ialah diarrhea related to disease process as evidenced by dehydration. Jadi goal untuk nursing diagnosis ni ialah the patient will utilize medications to control diarrhea and symptoms as prescribed. Nursing intervention satu ialah assess abdomen to increase frequency of bowel sound in expected with diarrhea. Number 2 is monitor intake and output. Can help monitor the patient fluid status and prevent dehydration. Number 3 is administer medications as needed. It to help relieve symptoms of diarrhea. Number 4 is refer the patient to a dietitian to help ensure adequate dietary intake and facilitate recovery. That's all.
Yang nursing care plan bagi aku pula, anxiety and fear related to disease as evidenced by express deep sadness. Goal dia, the patient will be able to freely express feelings also with dying. Number 1, always use therapeutic communication. This allows the establish of interpersonal relationships with the patient. Second, assist the patient in life planning. Advanced planning improve end of life care and promotes satisfaction of both patients and families. It also reduces stress, depression, and powerlessness. Acknowledge the normality of negative feelings like fear, anger, and denial. It is normal to feel a negative emotion when faced with loss. Allowing the patient to express feeling and emotion can make the patient feel important and acknowledged. Lastly, encourage patient with life review and reminiscence. Finding an acceptable and satisfying completion in life helps relieve discomfort, reduce stress, and gain acceptance of the situation.
Next nursing care plan is risk of infection related to chemotherapy and surgical intervention. The first one is assess vital signs and laboratory values. Alteration in laboratory values like neutropenia or leukocytosis can indicate infection. Signs of infection include fever, shaking, chills, and hypotension. Number 2, encourage and practice good hand washing before and after patient care. Hand washing can help prevent the transmission of pathogen and avoid infection. Number 3, isolate the patient during ongoing chemotherapy or radiant treatment. Isolating the patient can help prevent infections easily transmitted through direct contact. Number 4, avoid alcohol or smoking. Both must be avoided completely to allow the immune system to function at its best.
You have see that our flow of the slides of the contents. That's all that our team can do, and that's all from us. Thank you.